and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida and all around the world and the country. This is Lou Biasi with All County Healthcare. Tonight we're going to change a little bit of the format, a little different now. We don't have a doctor on tonight, but we're going to talk something about telemedicine and telehealth. You know, just recently, during these trying times of COVID-19, there's been a tremendous influx of these telehealth and telemedicine calls. You know, and I just had one recently, and it was amazing how disappointed I was. I got a telehealth call, and I won't say from who, but he meant well. He called me up, and he said, how you feeling? I said, fine, feeling fine. Everything looked okay. He talked 20 minutes with me. It was like me talking to my friend at the golf course, but he never knew any of my vital signs. He never knew my EKG. He didn't know anything about me that day that I was taking this telehealth call. At the end of the conversation, we said goodbye, and he ended up billing Medicare, which was fine, you know. But here's the problem. The problem is you cannot, this trying day when people are sick and you're elderly and you don't want to go to the doctor's office or you don't want someone to come to your house, you really don't know what your health condition is on a telehealth call. Because what happens is he basically is going to call you, just like I said, and not have any idea of what your body temperature is, what your oxygen levels are, what your heart rate is, how's your EKG, any of those situations. But, you know, there is a solution. The solution is that you have to give up the factor of these doctors using what I call the iPhone or using the iPad or using basically the computer. Or somebody just told me today they were on Skype. Well, they're allowed to do this. I don't blame the doctors. Doctors have to do what they have to do to try to treat their patients. But guess what? I'm involved with a company right now that took us 3 years to come up with a telehealth product that will resolve all of these problems. The factor is you have a product called the Link 2 by LiveCare. As you can see, it's right here. Link 2 by LiveCare. It's distributed by American Telemedicine. We at All County have been using it. And I got to tell you, we're giving it to our patients. They absolutely love it. What it does, you basically give it good quality care. You install the Link Plus, which is a small device that you can see is right there in the doctor's hand. It's that little device that you see on the screen. It's right here. That little, excuse me, it's a small device that the doctor has. He's holding it up. That sits by your bedside, and every morning or every night before you go to bed, you take your vital signs. You can take your blood pressure. You could take your temperature. You could take your glucometer reading, which is your diabetes reading, your sugar reading. You have an EKG machine. You have a scale. You have also oxygen level, take your oxygen levels. So you have every device that you would have if you took a visit in the physician's office, and if he did a triage where the nurse is taking all these vital signs, and all as he does, those vital signs will be passed on to the doctor. when you're in his office. Now, he knows all of this. He knows your reading from when you were in there last time to comparison. What happened to me one day is I went for a visit to my primary care physician, not knowing. He took an EKG and he told me, gee, I had a heart attack. I don't believe I had a heart attack. But then I went again for stress tests. Guess what? I ended up having AFib. All right? I know a lot of people in this country have AFib, especially as you grow older, you have AFib. And if you have any kind of sleep disorder, that can cause it. I have sleep apnea and it causes AFib. But when I get a telemedicine visit, I expect to get a visit that will really give me some idea of what my problems are or how do I compare it from the last visit I went to. Well, when I said about the Live Care Link Plus, that will give the physician everything he needs up to date. Link Plus will be basically, it's installed in your home. And it's a device that's been worked on for over 3 years with a tremendous amount of investment in it. And what happened was they designed a whole system that primarily is HIPAA approved, FDA approved, and it's patented. So what do you mean by HIPAA approved and FDA approved? That means that, for instance, it's secure. When you're taking a telemedicine visit or a telehealth visit on your iPhone or on your laptop, that's not HIPAA approved or FDA approved. That means someone can get into that, hack it, and there's a tremendous amount of hacking on it, and get all your information that you possibly need that they can get in the wrong hands. With a Live Care Link Plus, they never can get that. We're promoting Live Care Link because I tell you, being a senior, I was living alone, and I was end up one day passed out, and I had no one to call, and neighbor came over, got me to the hospital, and ever since that, I said, I need something in the home in case of an emergency. So I went out and I got myself, I fell, can't get up device, which basically you press the button, and the ambulance, EMT comes over, and they'll send an ambulance or to take you to the hospital right away. Well, what happened was I wasn't home, and the device went off without me being home. EMT came late at night, broke into my home. Of course, there was no one there, right? And the next day, I get a big bill for a new door because they have to break in to make sure that you're all right. Well, that didn't sit well. Another thing, I gave it to another friend of mine. She ended up having it, and the same thing happened to her. They broke into her home. She got caught for the new door. Well, of course, they have to break in, and when they get in there, they send you to the hospital, whether you need it or not. And then what happens to that? You get a hospital bill. You get a copay bill. 70% of the people that are on those devices, according to EMT professionals, do not have to be transported to the hospital. The difference now that I said, wait a minute. When I saw this Live Care thing, the Link Plus, I said, I got to try it. Guess what? I tried it, and I love it. My doctor has it in his office. He has the portal. Every morning I take my vitals, and if something goes wrong, he'll call me and tell me, listen, Lou, right now your protocols of your blood pressure is up or your glucose readings are high. If something goes wrong, he gets a red flag at his office. So when we designed this product, when this product was designed, it was designed mainly for physicians to use what we call remote patient monitoring. Medicare would like to keep all these readmissions that are going back and forth at the hospital to try to stay out of the hospital. And what they're doing now, they're paying the doctors X amount of dollars to do remote patient monitoring. So when the remote patient monitoring came out, this company designed, this Live Care, designed a system for physicians. Physicians now would give it to their patients. The patients would take the readings and take everything, and the patient would be monitored on a daily basis, by daily basis. And if something came up, the doctor would see a red flag on the device, and he would call the patient, maybe talk to the patient on our device, which basically has a video, has a verbal and video call device that he could call the patient on this little simple device, as you can see, right there, what's holding it, right? He calls the patient of that, And the patient now, he can see the patient, talk to him. If the patient has a wound or anything else, he can view the wound. If he sees the patient, basically, blood pressure is very high, he can change the medication while he's talking to the patient. Because why? He has the up-to-minute data right on that patient. Whatever that patient took that morning for vital signs, he's seen it. He's seen it throughout the whole month. So he knows what's going on with the patient on a monthly basis. Now, that's for the physician. And I said to myself, I'm in the home care business. COVID is here, COVID-19. What are we going to do? We went and bought all the PPE equipment. Patients didn't want anybody in the house. So we had to say to our nurses, listen, if you want to go in and see the patient, please do. It was very hard to get a nurse to go in. What we did, we gave this to our patients for no charge. We tested it out. A patient didn't only love it, the patient's family loved it. Why? Because now every morning we monitored the patient. We knew what his temperature was. We knew what his blood pressure was. We knew what his vital signs were. Also, his family member, who might be living in New York or somewhere else, they could view it. They could get into the system and see it. And if we realized he had a problem, we could also call the physician. The physician could get in and see the up-to-date data on that patient, call the patient, either have him come to the office or change his medication at the home. Now, that's true telemedicine. Telehealth. When you know what the patient is involved in, you understand that the patient could have a problem. But right now, I guess we're going to take a little break, 30-second break. We're going to take a 30-second break, come back and talk more about telehealth.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. First. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back. Listen, we just told you what the doctor could do with telehealth. The Live Care, the Link Plus, we modified it to the point where you, the individual, should have this in your home. If you're living alone, you're a senior, you're 50, you have any pre-existing conditions, guess what? This is a lifesaver. This is something I always say to people, would you go on a boat and out to sea on a little boat without a life preserver? Well, guess what? What do we have at home? You get sick, you're going to call 911 if you can get to a phone. Now, what we designed this for both the home care individual, the home care health company, and also the individual himself. Again, if you're 50, living alone, 60, 65, pre-existing condition, you've got to have this in your house. How do you hear about this? Well, how do you know about it? You go to the website, our website. It's bestamericantelemedicine.com, bestamericantelemedicine.com, or you can call American Telemedicine at 561-278-2222. That's 561-278-2222. If you're wearing that bracelet, I fell, I can't get up, Trade it in. Believe me, get rid of it, because this is the thing you want to go to. You know, we just installed this again to one of our patients. When my the nurse went over to install it with the patient's son was there. And he said, you know, that's all of that. He said, that's got to be very, very expensive. So they said, no, it's not expensive. Well, what do you mean it's not expensive? It's only $45 a month. $45 a month, and I get my blood pressure checked, my glucose checked, my EKG checked. I get all of that. Plus, it has fall detection if I want to leave the house. That's what you get for $45. He said, you know, I'm paying right now, ADT, $60 a month just for fall detection. Well, why would you pay $60 a month for fall detection when LiveCare Link has fall detection on it and GPS? It also says that you can take this device, wear it around your neck when you're leaving, or hold it as a bracelet. When you're leaving the home, it has GPS on it. That means if you're lost, guess what? It will find you right away. That means your daughter can now call you, your son can call you, a family member can call you on your device. Right? If you're going to fall, it's going to say, Lou, please sit down. You may be able to fall. There's fall detection. Nobody has that. No one has that. So now, the doctor can have it. You as an individual should definitely have it. For $45 a month, guess what? It's a little more than $1 a day. If you take $45 a month and divide it by 24 hours in a day, by the number of days in a month, it's pennies an hour. You pay a home health aide $16 to $20 an hour. You know, that's another thing. If you have a home health aide professional working with you, an aide, you know, that means you need some kind of care because they're helping you with your activities for daily living. That means if they're there, most people can't afford 24/7 care anymore. It's too expensive with the overtime, etc. So most of the clients are getting 4, 6, 8, 10 hours of care a day. Guess what? Tell your home health care company that's taking care of you, I want the LiveCare Link in my house because when you leave, I'm alone. That means when you're alone, you're alone. When the most accidents happen, when you get out of bed on the way to the bathroom or somewhere in the home, you're going to fall, you're going to trip, you don't have the lights on, the aide's not there. You know, my own mother, before this device came out, God rest her soul, she was lying on the floor for 12 hours before anybody found her. 12 hours, right? And what happened, her diabetes went down and she passed out, right? Couldn't get up because she had problems with getting up and sitting down. So as a result, she was there 12 hours. I don't want any senior citizen to be on the floor for 12 hours. I don't want any person to be at home without some kind of what I call 24/7 protection, right? You have an alarm, burglar alarm system in your home. Why? In case somebody breaks in, the burglar alarm goes off. You pay so much for that. You have a smoke detector. If the smoke detector goes up, the house goes on fire, you have the smoke detector go off. But if you fall or trip, you have nothing. You have something now. You're never alone with the Link Plus. 24/7, it's with you. 24/7, you have the Link Plus. With the capability of even your doctor talking to you, your family member talking to you. So if you're getting any kind of care, whether it's assisted, just care for activities for daily living, 4, 6, 8 hours a day, tell your home care company, why don't you get this for me? And maybe they should take it and cover it and monitor it. See, what happens is, if you take this system, all the information that you put into the Link Plus is then transferred into the portal that either your son can control, your daughter can control, the doctor can control, or your home health care company can control. That information goes into the portal. Every day that we know that you're taking your vital signs, if something goes wrong, the red flag comes up. It tells the person looking at that portal that something is out of whack in your system. Either your blood pressure is high, your glucose is very high, that means your diabetes is getting up there and high. Either your heart rate isn't working right. We got a scale, your temperature is too high. And what's the most important things that people look for in COVID today? What's your oxygen levels? What's your temperature? What's your heart rate? right? You'll know that. Hey, I'm at home daily by myself. I take it 2 to 3 times a day when I'm home. My doctor says, stop taking it. You're all right. Stop taking it. We see it. Thank God I have it. Thank God it's there. I know I don't have COVID because my oxygen levels are very good. My temperature is very good. So guess what? When you spend less than $1 a day, a little more than $1 a day to protect your life, I do. A little more than $1 a day, $45 a month, you have a system that basically is your life preserver. As I said, you wouldn't go on a boat without a life preserver. Why stay at home without a life preserver? The Link Plus is your 24/7 life preserver. I don't know how much more time I have, but we'll talk about it. Now, if you want to call in and ask me any questions, you can call 888-565-1470. If you want to know more about the Link Plus, please call 561-278-2222. Or please go on our website. It's bestamericantelemedicine.com. bestamericantelemedicine.com. And I'm going to tell you something. If you don't like it, give it back. No charge. I believe in this product so much that I'm saying I will give it to all my friends. And if they don't find that this is primarily what I said, a life preserver, then I say send it back to us, no charge. But I'll guarantee you'll keep it. When the gentleman I told you about, we gave it to him as a test. He realized, he took his temperature, he took his everything. When he got to his blood pressure, he realized it was so high that, as I told you, when he went to the doctor, he was put on medication right away. Guess what? We probably saved him from getting a stroke. Do you know what your temperature is every day? Do you know what your blood pressure is every day? And if you don't take it, guess what? We have a reminder. It calls you right on that Link Plus. It says, please take your temperature, take your vital signs. It reminds you, it has notes on it. Your family member can call you. Ma, how you doing? Matter of fact, she can even see your vital signs. At the end of the month, you get a complete printout of all what you've taken that month, of all your vital signs. When you go to the physician, you bring it with you, and she says, listen, these are my vital signs for the month. He will look at them, and you'll say, that's amazing. Where did you get them? Well, I got the Link Plus. And if he decides that he wants to take over because you have pre-existing conditions and he wants to have remote patient monitoring, then he can take it over and he can look at it and he can control the portal. He can basically know what's going on with you, and he gets paid by Medicare for that. He gets paid Medicare for what we call remote patient monitoring or chronic care management. That means if you have any underlying conditions, blood pressure problems, diabetes problems, heart problems, any problem you have, the Link Plus will monitor you, will tell you exactly what your numbers are that day. How does it work? It goes, number one, you take your blood pressure. That blood pressure count goes into what you would call the Link Plus. That Link Plus transfers it to the portal. The portal now will let you know what's going on. They're just telling me I have a few minutes left. Is that what I have? A couple of minutes left? So in those couple of minutes, please do yourself a favor. And if you're a family member and your mother's living alone, your father's living alone, please get it for them. This is a must. In today's day and age, with COVID-19, with the doctors not seeing you anymore, this is a must that you have to have in your house, your mother's house. Please, I don't want to repeat myself. Call, again, 561-278-2222, and one of our reps will talk to you. We'll make sure you get it. Free. If you don't like it, it's free. That's it. Thank you so much, and you have a wonderful, wonderful evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests,